Now, for a more in-depth expert discussion on COVID-19, let's turn to our Daily Corner On Point, where we speak to experts in their field to dig deeper into the biggest news stories in the spotlight. Like we've mentioned before, there was kind of a temporary lull, wasn't there, in new daily COVID-19 infections. However, as we've been reporting over the past 48 hours or so, South Korea again topped 2,000 new cases on Wednesday, and it appears to be on course to post similar numbers, if not higher, on Thursday.
Despite the toughest level of social distancing remaining in place for weeks in the capital area, as well as more and more people being vaccinated by the day, the number continues to be stubbornly high. Now, for more on the situation, we have Dr. Alice Tan, internist at Mizmedi Women's Hospital, joining us on Skype. Dr. Tan, welcome.
Thank you for having me.
Now, we're seeing an uptick as a result of the recent three-day weekend. The problem is we have another starting tomorrow, and people naturally want to move around during that time. Do you foresee this double whammy leading to a post-Chuseok situation where we're seeing daily cases exceeded 3,000 again?
Yes, unfortunately, I do anticipate that the number of positive cases will increase. Not just because of the series of holidays that started with the Chuseok holiday, but because the virus is becoming so widespread in the Seoul metro area, but also throughout the country. The KDCA reported that over the month of September, even though the number of daily average cases increased, the number of identified clusters went down from 103 to only 33. At the same time, the number of cases that were detected that were within the epidemiological surveillance network decreased to below 30%. And the number of cases of unknown epidemiological link now is almost 12,000. So unless there is a huge testing campaign to detect all of the thousands of people who are positive but still in the community, I don't see that the number of cases will actually meaningfully go down.
Yeah, tracing has always been a huge problem for South Korea, as well as many other countries around the world. But South Korea, as we just heard from our Cheo Won-jong before, will start giving booster shots to certain groups from this month. And South Korea will be joining several other countries. They all have their different policies, of course. But South Korea is not going to give booster shots to everyone, at least for now. The WHO, though, says that richer countries like South Korea, the United States, etc., should actually wait for poorer nations to give first and second shots to their populations before going ahead with this. Where exactly do you stand on this issue?
I do agree with the WHO in part. I think it's important for Korea to start administering booster shots to the elderly of the country. During September, the number of cases who were greater than 60 years old went up by 75%. And that's simply not a tenable situation. We do need to protect our elders. We also need to protect our healthcare workers who were given the vaccine early on. There's evidence that immunity may be waning now, and so we do need to protect our healthcare workers, because once infections start in the healthcare worker population, that can lead to spread of the infection in hospitals. And if we have a decrease in the number of healthcare workers who are able to work because they're in quarantine, that can have very devastating downstream effects. So I don't think we should be giving boosters to all low-risk groups, because, of course, that will lead to a shortage, an increased shortage of vaccines available throughout the world. That will only make the situation worse. It's a self-defeating policy to do that. But I think that vaccinating our elders and high-risk healthcare workers with boosters is a good policy that we do need to pursue.
Now, breakthrough cases are exploding, topping a fifth of all cases in the last week of September. South Korea isn't the only country seeing this. Has it reached a point where regular COVID-19 booster shots are the norm like the flu? And as a follow-up to that, do you think it's time to stop labeling this a pandemic and admit it's an endemic?
Well, I think it's both. I mean, it's still a pandemic, but as you're saying, it is an endemic disease. COVID-19 is not going to disappear for at least several years into the future. And I think what we need to do is continue with our strong vaccination campaign. On the other hand, it's very important to also have a strong surveillance network for genetic mutations so that we can stay on top of genetic mutations and make sure that our vaccines and our therapeutics are well targeted against the genetic strains that are prevalent. And this is going forward for the next several years, I think the policy that we need to pursue. We have some antiviral therapeutics that are in development in the pipeline, and hopefully they will be released soon. But usually with antiviral medications, it takes a little bit of time, and then there's resistance that the virus can develop. And so that's where the surveillance and the constant development of new antivirals to protect against the emerging strains, that's where that point becomes very important.
And finally, Doctor, to a question that's really been on a great many parents' minds, including myself. The South Korean government says minors between the ages of 12 and 17, providing they have their parents' consent, can be vaccinated soon. However, it must be said that there is a CDC study out there that shows COVID-19 has killed a negligible number of otherwise healthy children. Do you really think it's necessary to vaccinate young kids against a virus which studies have shown the overwhelming majority, providing they are healthy and don't have any comorbidities, recover quickly from in many, many cases? And if you don't agree with that and believe they should be vaccinated, why exactly do you think that way?
Well, there are two reasons why I strongly support vaccination in children. First of all, we don't know the full picture of what COVID-19 does to children. We think they've recovered fully, but this is a new disease. We don't know if perhaps there will be sequelae that we discover months or years down the line. The other reason is, we already vaccinate our children for against about a dozen other infectious diseases, such as hepatitis A, hepatitis B, chickenpox, diphtheria. And the reason why is not only because vaccinations save lives, but also because vaccinations help prevent deafness, also liver failure, other outcomes that are not necessarily fatal. The other reason is because COVID-19 is so infectious, we want to prevent the circulation of this virus in schools, in groups. Our children spend so much time in congregate settings. And the virus could circulate in these settings and then from there be passed on to vulnerable adults. And so this is a situation that we want to prevent. COVID-19 has caused such a disruption to our children's education and had a negative impact on their well-being. Vaccination really is the way to protect them and to make sure that they can stay safe and enjoy their childhoods again.
Dr. Tan, we again appreciate your insights about this health crisis. We look forward to speaking with you again soon. That was Dr. Alice Tan, internist at Mizmedi Women's Hospital on South Korea's fight against the virus.